Good afternoon. Here is our latest update on COVID-19 in Pennsylvania. As of 12 a.m. this morning, we have 356 new cases of COVID-19. This brings our statewide total to 72,282 Pennsylvanians who have tested positive in all 67 counties. Tragically, 5,567 deaths have now been attributed to COVID-19 in Pennsylvania. Statewide, we are estimating that 67% of people who have had COVID-19 have now recovered. Even before the arrival of COVID-19 in our Commonwealth, the Pennsylvania Department of Health has been committed to improving the quality of life for vulnerable Pennsylvanians, including seniors and those living in long-term care facilities. Nursing homes were once thought of as almost a retirement home, but today they are so much more. Today's quote-unquote retirement home is a combination of personal care homes and assisted living facilities, and those are regulated by the Department of Human Services, and skilled nursing facilities for residents with serious medical conditions that often require constant care. And those nursing homes are regulated by the Department of Health. In addition, the care residents need in skilled nursing facilities has required a change in how we regulate those facilities. And that is something we have been working on since the start of the Wolf administration. We have implemented recommendations from the Auditor General and the Nursing Home Task Force, including resuming anonymous complaint reporting. And we are working to update and rewrite our regulations to ensure that they protect the residents of today and tomorrow. We have continued to conduct virtual and on-site inspections when investigations are warranted. Unfortunately, the very nature of a long-term care facility setting makes these places more susceptible to the spread of illnesses, such as COVID-19. These facilities are congregate settings that house seniors, those usually 65 and older, and those with chronic medical conditions such as heart disease, lung disease such as chronic obstructive pulmonary disease, and those make residents more susceptible to infection from this very contagious respiratory virus. COVID-19 has significantly impacted long-term care facilities across the United States and around the world, facilities in states very near us that have had significant rates of COVID-19, such as New York and New Jersey and Maryland, in New England, Massachusetts, Rhode Island, and the Midwest and Illinois. When COVID-19 first appeared, we recognized that this virus could easily spread in nursing homes and other congregate facilities. We instituted guidelines provided by the CDC early in March when the first cases were detected in Pennsylvania, including limiting outside individuals, visitors, from entering long-term care facilities. Recent studies have shown that when there is an increase in cases in a county and community spread of COVID-19, there is a direct impact on the long-term care facilities in that area. This impact is especially evident in counties where there is more population density and widespread community transmission of COVID-19. We know that many individuals with COVID-19 can be asymptomatic, but yet very contagious. And that's how brave and courageous staff members who have dedicated their lives for caring for these vulnerable Pennsylvanians unknowingly spread COVID-19 into these facilities. It's important to remember that for most residents of long-term care facilities, this is their home. Therefore, following federal guidance from the Center for Medicare and Medicaid Services, if a resident has tested positive for COVID-19 at a facility and then required hospitalization because of their symptoms, when they recovered, they were returned home to their facility. It's important to understand that this did not bring new cases of COVID-19 into the facility because that's where the resident initially came in contact with the virus in the first place. When they got home, these residents were once again separated from others who were believed not to have COVID-19, just as they had been before they required hospital care. Many long-term care facilities in our Commonwealth have successfully prevented COVID-19 from becoming widespread following our protocols and CDC and CMS's protocols. But unfortunately, in some, COVID-19 has been much harder to contain. Whenever a long-term care facility in Pennsylvania reports a single case of COVID-19, we consider that to be essentially an outbreak. We do a variety of assessments in that situation and offer up numerous resources. This includes working with our infection control team and making additional resources available, such as our infection control consultants, ECRI, or in cases where there are severe staffing issues, deploying the Pennsylvania National Guard as essentially a strike team to assist those facilities. Now, we have had instances where facilities with COVID infections have actually turned down these services, even though we felt it would be beneficial. One reason for this, we think, might be that they were afraid that they would be cited for failing to follow procedures. But I'd like to emphasize that is not the Department of Health's intention. Our priority is actually halting the spread of COVID-19. So we have supported long-term care facilities with approximately 1,800 shipments of personal protective equipment, or PPE, including more than 2 million N95 masks specifically for long-term care facilities. We are now implementing a plan to test every long-term care staff worker and resident to identify where COVID-19 exists. Now, we are starting to see a significant decline in new cases in staff and residents in long-term care facilities, as well as a decline in deaths. But the threat to these facilities is not over. We will continue to pursue additional tactics that will allow us to protect and improve the quality of life for Pennsylvania in these long-term care facilities. The best way to stop this virus from continuing to harm these and other vulnerable populations is to stop it from entering the long-term care facility in the first place. So we need to do everything we can to help prevent the workers from coming into contact with virus in their communities. It's essential then, as we work to relax our social distancing and we go from red to yellow and yellow to green, that we stay alert to prevent the spread of this very contagious virus, COVID-19. Now, here are my daily reminders. Please wash your hands with soap and water for at least 20 seconds, or the time it takes to sing Happy Birthday twice. Or use hand sanitizer if soap and water are not available. Cover any coughs or sneezes with your elbow, not with your hands, and try not to touch your face, especially after touching surfaces that can spread the virus. Clean surfaces frequently. And if you have to go out for life-sustaining activities, please wear a mask if you're going to come into contact with others. If you have questions about your health, please contact your health care provider. If you need mental health resources because you or someone you know is experiencing a mental health crisis, please contact the crisis text line by texting PA to 741-741, or call the statewide support and referral helpline at 1-855-284-2494. Again, 1-855-284-2494. If you or someone you know needs help with a substance use disorder, please call the Department of Drug and Alcohol Program hotline at 1-800-662-HELP. Again, 1-800-662-HELP. For the most reliable information related to Pennsylvania's response, please visit our website at health.pa.gov. And what is most important for Pennsylvanians to remember now is stay calm, stay alert, and stay safe. And now I will turn things over to my friend and colleague, the Secretary of the Department of Aging, Secretary Torres.
Good afternoon. I'm pleased to join my colleague, Secretary Levine, today to talk about what the Department of Aging has been doing to help older adults during the COVID-19 pandemic and how we are preparing to support seniors as Pennsylvania reopens and counties continue to transition into the green phase. First, I want to thank our department staff, our network of aging providers, direct care workers, community volunteers, and family caregivers for all the work you've been doing to protect the safety and well-being of older Pennsylvanians. Since the first case of COVID-19 was announced, our area agencies on aging and local providers have been on the ground making sure that the needs of older adults are being met, including nutrition, medication, social connection, and other essential needs. Through it all, our department has maintained close contact with the Aging Network to share updates and ensure critical information and services continue to reach older adults in need. As the governor's stay-at-home orders are lifted, we all must continue to practice the safety measures in place to protect ourselves, our families, and our most vulnerable citizens. In preparation for Pennsylvania's phased-in reopening, we created work groups and engaged area agencies on aging to develop procedures and best practices for resuming operations of adult day centers, senior community centers, aging services that involve in-person contacts and in-home visits, and protective services. This has all been done with the overarching objective of ensuring the health and safety of both participants and staff. We recognize that there is not a one-size-fits-all approach to reopening these centers. The process of reopening will be conducted gradually, strategically, and cautiously, while allowing flexibility at the local level to keep older adults and staff safe. Some area agencies on aging and senior centers may choose to reopen for in-person consumer services at a slower pace. Our ongoing support for them will focus on working within the existing guidance to make service and activity decisions that best fit their individual capacities and situations. Recognizing that seniors have ongoing concerns and fears, we will continue for some time alternative services and practices implemented as a result of this pandemic, such as maintaining different modes of getting meals to seniors. If any older adults needs a meal or in-home support, please call your local area agency on aging. They are available to support you. If you are an individual with a disability and need help, please call the Pennsylvania Link at 1-800-753-8827 to get connected to resources that can assist you. Our Protective Services Office has continued to operate throughout the pandemic with face-to-face safety measures in place to protect older adults and investigative staff. These services have never stopped. If you suspect elder abuse, please call the statewide reporting hotline at 1-800-490-8505. This hotline is answered by a live person 24 hours a day, 7 days a week. COVID-19 has disproportionately affected older adults. Before the pandemic started, the Department of Aging was already working on another issue that affects the health and well-being of older adults: loneliness and social isolation. The social distancing required during the pandemic made this issue even more challenging, but it has also created opportunities to adapt and innovate. We're creating partnerships and technology solutions that will empower older adults to connect and enrich their lives in new ways beyond the pandemic. Our Pennsylvania Council on Aging has formed a social isolation task force focused on 3 areas: risk reduction, socialization, and technology. They recently conducted a survey of 3,700 older adults to find out how they were coping during the pandemic and to learn how we can better address some of their needs. One of the things that we learned is that seniors, even those in the 80-plus age range, are interested in using technology to get services, connect with loved ones, attend religious services, and enrich their lives. They just need access. Our department, through our Office of Long-Term Care Ombudsman, has partnered on and supported 2 new resources to help individuals connect with loved ones in long-term care facilities. In early May, Volunteer Ombudsman launched the Virtual Family Council. This program uses a virtual platform to hold weekly meetings with families to support them and facilitate connections with loved ones. More information on the Virtual Family Council is available on our department's website at aging.pa.gov. We have also developed a partnership with AARP to distribute activated cell phones and tablets to targeted nursing homes to help increase communications between residents, their families, and loved ones. This is a pilot program that we are hoping to expand. In addition, we recently received over $3 million in CARES Act funding for our Pennsylvania link to aging and disability resources. We will use these funds to provide assistive technology, strengthen connectivity, and enhance training for older adults, all with an eye toward improving access to services and helping to combat social isolation. Finally, another initiative that we are excited about is an effort to work with the state system of higher education on how we could engage students and faculty at our state universities to help study and address social isolation. As a result, we are now collaborating with 6 different universities on the potential of creating service learning and other programs for this purpose. These partnerships would include engagement with departments of social work, public health, recreational therapy, and behavioral sciences. It is a great opportunity to get college students interested in our field and work to resolve critical issues among our seniors. It's been an incredibly challenging time for older adults and those who serve them. However, I believe our aging network will emerge from this experience stronger than ever. The governor has challenged all of us to take our lessons learned during this emergency and translate them into meaningful changes on how we deliver services, and we're working toward that new future to meet the growing needs of those we serve. Thank you.
Hello.
So Philly and the other areas in the southeast are expected to move into the yellow phase this upcoming Friday. With the protests and the riots that are happening right now, is there any plans or is there any possibility that there could be a delay in Philadelphia County going into the yellow zone?
There are no discussions at this time to delay Philadelphia from going into the yellow zone. We certainly respect Pennsylvanians' right to protest and demonstrate, especially in these very difficult and challenging times. We would want them to be safe, however, and to wear a mask and practice social distancing as much as possible while they're exercising their civil rights. We do have concerns about the potential for spread of COVID-19 with mass protests if they don't practice social distancing, but there are no plans to change anything.
And if I may just follow up on that real quick. With a lot of the looting that you see going on, is there a concern people are handing items over to each other? Obviously, there's a fear of germ spreading that way as well. So are you fearful, or are you concerned, rather, that there could be an uptick?
Public health authorities throughout the country have been concerned about the impact of these protests if social distancing is not practiced and if masks are not worn, and we'll do everything we can to mitigate that.
Sarah Van Fort.
This is Sarah Simon with Spotlight PA. Secretary, there was updated testing guidance for long-term care facilities released over the weekend. I was wondering if you could explain what's new, what's an improvement about this guidance.
So there was some new guidance from CMS. It really isn't that new. I mean, they really want us to test every staff member and every resident in long-term care facilities. And we are working towards that now. We have approximately 45 or more facilities that have been tested, and we're going to be testing all of the nursing homes and also all of the personal care homes. That's approximately 1,900 or more facilities. We will be prioritizing certain facilities that have had a lot of cases. We'll certainly be prioritizing facilities that are in, as I said, areas that have had a lot of high prevalence of COVID-19 and have high population density. So we're going to have to prioritize that, but we're going to be testing everyone.
But what about that is new? I'm trying to understand what.
Yeah, I'm not sure exactly what was brand new in that. We'll do a deep dive onto it. It was just released this weekend, but we have our plans already made. If there's something different than they want us to do, we'll do it.
Ford and Jan.
Dr. Levine, sort of a two-parter. Number one, where is Governor Wolf today? And the other part would be, given these protests and the gatherings and the potential for spreading COVID, Did the department ever look at the big rally that was held in front of the Capitol a month ago to see if COVID was spread there?
So the governor is in Philadelphia today, and we have not seen any specific spike in cases from the protests in Harrisburg. Of course, that's difficult to do because there are a lot of different people from throughout our area, but actually throughout the state, and actually people from outside the state. They don't give us their names and where they are to be able to track them. So there's no specific spike from that. We'll be watching for specific increases in the areas that had protests, such as in Philadelphia, Harrisburg had protests, and Pittsburgh had protests, as well as actually some other smaller cities. But again, it's difficult to tell because people don't only come from those areas, and of course, we have no identifiers.
Jan?
Secretary, I was wondering, the mayor of Atlanta had recommended that people that did participate in protests down there go get COVID tested this week. And I was wondering, do you recommend that for the folks here in Pennsylvania?
Well, if you get tested, I mean, the incubation period is 2 to 14 days with an average of 5 days. So, I mean, to get tested like the next day probably would not be as valuable. I think that that's an interesting thought. I had not heard that before. I think that it's certainly something that people could do is to get tested, probably wait at least several days and get tested or up to 14 days. Of course, if they have any symptoms, they absolutely should get tested. To just go in and get tested would be fine. I'm not coming out with an official recommendation on that, but that would be interesting. But certainly, if anybody has symptoms, we want them to get tested.
Denny, then Pat?
Hi. You mentioned testing all the residents at the long-term facilities and the employees once or in perpetuity, or how long?
Well, we're going to need to do that on a regular basis, and what we're going to do is individualize it to the facility. So, so if there's a facility that has had a lot of cases, then we're going to want to be testing more. If there's facilities in high population density areas that have had a high prevalence of COVID-19, we'll want more testing. If they're if they've had no cases in a rural area that has had very little COVID-19, then they need less testing. So we're going to individualize that to the facility and their specific circumstances. But you're right, one test is not conclusive. You need to keep doing tests. And we're continuing to expand testing throughout the state, and we'll be working with the facilities on accomplishing that.
Tad, then Justin?
Secretary, how long do you expect that testing process to go in those facilities? And then as a follow-up, Jersey Shore Manor Care, of course, has that huge outbreak or has had that. Where would they be on that list?
So I don't know specifically where they are on the list, but we can check on that and get back to you. Well, this is going to need to be ongoing. I mean, it's not going to, the testing of the staff and the person and the patients in long-term facilities is going to have to continue until we have a vaccine, so there's no longer needs to be done. So it will be a significant ongoing effort.
Justin, then Barbara, or I'm sorry, Sarah Goulet.
You said that the very nature of congregate care facilities makes them particularly susceptible, to outbreaks. Given that some have worried about a potential second wave in the fall, are you worried that a second wave could hit these facilities as hard as it did this spring? And what efforts do you see the state needing to make in order to prevent that from happening?
So we have a number of different procedures and plans that we're working on. One is to significantly expand testing. So we're going to be, as we said, continuing that testing. What it would be very helpful and very important is if there is a very accurate point of care rapid test. Right now, we have the Abbott test, and there's been concerns about the sensitivity of that test and the false negative rate. There's also been sometimes some shortages in the test kits, but we need very plentiful, rapid, very accurate point-of-care test where we can test those individuals, the staff and the residents, on a regular basis. We can test visitors on a regular basis, and I think that will help us detect these asymptomatic carriers that bring in the virus in the first place, and we can hopefully prevent its spread. In addition, we need to continue to work on different ways of clustering and congregating people in nursing homes to try to protect them if there's positive cases. We need to to continue to push out personal protective equipment. We'll need those stores from the federal government to be able to do that. And so we are developing plans for the fall, both for the general public and specifically to those facilities. The other thing that would be very useful in addition to the rapid virus test would be accurate antibody tests. So hopefully by then we'll have proven that the antibody tests are at least somewhat protective. That's not yet proven, but hopefully it will be within 3 or more months. And then also there's a rapid, accurate antibody test. And I think you put those together and we'll be way ahead of the game in terms of long-term care facilities and protecting them.
Sarah Goulet and Barbara.
This question is from the Lewistown Sentinel, Secretary Levine. What guidance can you give to tour bus companies regarding resuming operations, especially for trips to other states whose current restrictions may differ from Pennsylvania's? And is there a limit to how many people can be on a bus at one time?
Probably about, I believe, we'll have to check our guidance, which is on the website, but probably 50% occupancy. And I mean, we're not going to prohibit people from traveling, but we're not encouraging people traveling, especially to areas that have had significant prevalence and incidence of COVID-19. And 50% occupancy, and then social distancing, 6 feet away, masks, hand washing, and everything we talk about every day.
Barbara, then Sarah Simon.
Secretary, would it have been better, you said when you sent patients to the hospital and then brought them back into their nursing homes, you don't think it would have been better to keep them out of that facility?
Well, so first of all, they contracted the virus in the facility. And so it doesn't mean that they were spreading the virus or bringing it to the facility. The virus is already there. And so I think that depending upon the circumstances, there's not that many other options for the patients. We are talking about other things for the future. We were very concerned at that time about patients in the hospital and overwhelming our hospitals. And so if they just stayed in the hospital, first of all, you can't just do that in terms of payment, but then also then we wouldn't have throughput through the hospital. There are some facilities, nursing home conglomerates that have a number of different facilities, and we're able to congregate people into different wings. Very small facilities can't really do that. So we worked with every facility to do the very best we can to protect everyone in the facility.
Sarah Simon.
A question about the long-term facilities data. There's a line in the disclaimer that says staff members who work at multiple facilities are attributed only to one to prevent double counting. I'm wondering if the intent of the table is to identify locations with outbreaks, why only count a staff member who may work at multiple facilities at once?
I think it's to avoid double counting, but I don't know the specifics in terms of that clause on the website, so we'll have to get back to you.
But cumulative count isn't important, right? If the intent is to understand the number of cases at each individual facility.
Both are important, but I mean, we know what facilities they work at, but I think it's an issue in terms of double counting and public reporting, but we're going to have to get back to you.
Or
Dr. Levine, can you briefly describe what contact tracing is going to look like for someone who is approached, not the person who's being traced, but someone who's approached? Say I'm at my house, I get a call, or someone knocks on my door and says, you've been exposed to someone who has COVID-19, we've told about you. Am I supposed to answer questions on everyone I've met with in the last 2 weeks or talked to personally?
So, sure, we'll discuss that. So contact tracing, increased testing, identifying people who are positive, doing a case investigation and learning about their contacts, and then doing contact tracing and appropriate quarantine is critically important now, and it'll be critically important in the future. So we have a number of different ways of doing that. They're very unlikely to knock on your door because we don't want the personal contact. So it's going to be some type of virtual contact to reach you. And then we're going to say anonymously that you have come in contact with someone with COVID-19. So we're not going to say you came in contact with Susan Smith who has COVID-19. And we know this, and so we're going to ask you to quarantine, and you'll get a quarantine letter. And then we will ask you about who else you might have been in contact with. So that is how it's going to go. We have found that people, actually both both when there were issues in terms of Ebola in 2014 and now, that people comply with isolation and quarantine very well, and they comply with our requests in terms of case investigation and contact tracing, and we're very pleased with the public's response to that.
Just as a follow-up, given the response to the virus restrictions by the public, very fractured at the least, wouldn't you expect that the contact tracing is going to run into difficulty, people not wanting to answer, not wanting to say, you know, you're not telling me who it is, why should I tell you, who I've been meeting with?
It's possible, but I have to tell you that has not been our experience. Our experience is that people cooperate very well.
Dan and Todd.
Secretary, I was wondering, with regard to the numbers that you put out every day about the long-term care facilities and the patients, I was wondering, have you given any thought to providing a percentage that recover? I mean, we never see that, and also, breaking out between the staff and the residents, the data.
Sure. So we do break out between the staff and the residents every day in terms of our website. I mean, I can tell you that there were 15,545 staff that have tested positive for the duration of the illness, and 2,663 staff. So we have that broken out. But we are going to put that on what's called an epi curve. And so I actually have discussed this with my staff over the last week, is that we want to see the course of it. And I can tell you that the epi curve is going very well. The numbers are going significantly down in terms of the number of patients with COVID-19, the number of staff with COVID-19, the number of facilities with COVID-19, and the deaths from COVID-19. But we need to make that more accessible to the public, and we will do that.
If I could just quickly follow up, people. Until there's a vaccine, what would you recommend for a staffer at one of these facilities that's asymptomatic?
I didn't hear you, I'm sorry.
Is asymptomatic?
Right.
And these facilities, until there's a vaccine,
Sure.
do they just quit their job? Or?
No, we don't recommend that the staff quit their jobs. I mean, the staff are amazing and extremely brave and courageous to continue to work in those settings with patients who are so vulnerable and need them so much. So we really thank them for their service. We need them at home to practice, as everybody is. We want people to wear masks. We want people to wash their hands. We want people to continue practice social distancing. And again, we're going to be testing them on a regular basis to make sure that even though they're asymptomatic, that they're not a carrier that can bring it into the facility.
Todd, and then Barbara, you got the last one.
Secretary, do you have any updates on the vaccine clinical trials that are going on, specifically UPMC as an example, and any other facilities in the state on their progress so far?
I really don't have a specific update on the vaccine trials. I mean, vaccine development takes a long time. We're all going to be really hopeful that with the President's Warp Speed initiative that it goes faster, but there are certain things that have to be done in terms of proving the effectiveness and the safety of vaccines. I don't have a specific update on the ones being developed in Pennsylvania, though.
Yeah, I was just wondering, with Governor Wolf talking about schools opening in the fall and some guidelines possibly coming out this week, any thought of plans for athletes competing in sports regarding testing? Are you thinking that far down the road as to how sports could actually happen at a high school level?
So there are discussions at the Governor's Policy Office level with the Department of Education and the Department of Health in terms of high school sports, and I believe more guidance will come out this week.
Thank you, Secretary.
Thank you very much.